I'm Harriet Birunji. I'm Vice President, International Programs Division with the Population Council based in Nairobi. For me, I've worked in the field of sexual and reproductive health for a long time. And I think there's been a missed opportunity for us as partners who are working and contributing to bringing about change on sexual and reproductive health outcomes to begin to work together and draw on each other's comparative advantage. And yet we haven't really had the opportunity to work together to influence the ground and to bring about the desired change collectively. So I think this is a wonderful opportunity that major players in sexual and reproductive health have come together to really sit down and think together and build something together for us and for our population here in Africa. You know, I think that the 5 C's are all equally important because they support each other. I work for a research organization. And yes, we can sit on our desks and generate data, but if we don't work closely together with other partners, the advocates, whom sometimes I call the noisemakers, who bring positive visibility around the issues, then our research will just remain in publications and not be utilized. Regarding the C's, without being selective, as I have emphasized, all the 5 C's are important. And here in particular, what would be really critical is to grow a whole generation of African researchers that are doing research on abortion. Within the region, we're using methodologies that have been developed from elsewhere. I suppose if we are able to grow this and at least identify key questions and answer locally generated questions, I think we'll make a lot of headway in building the evidence base. But also most critically is not just to create knowledge around abortion, but to be able to do operations research to identify program problems, test solutions, and be able to scale up those solutions to save lives. You know, the field of access to medical abortion has been extremely contentious. So 10 years down the line, I would like to see this as a service that is normalized, that one doesn't have to go in the background to access medical abortion services. I would like it to be like accessing malaria treatment. I would like it to be like accessing emergency contraception. I would like it to be just like any other service that anybody who needs it can use it and can access it. That's what I think better access at the end of the day would be important. I've seen situations where young people who are seeking abortion services are exploited, and partly because services are not readily available. And I also see that through through whatever work that we do through the Catalyst, we are able to bring about a reduction in severe abortion complications, because when you look at the data for the region, almost close to 50% of the fetal and severe complications for unsafe abortion are among young people. We still see in the world whereby medical abortion is known, we still are seeing young people resorting to very crude methods of abortion and eventually they die, which is really sad. So I hope that by organizing for this kind of change, we'll be able to save lives. And really, this is really about saving lives or transforming lives.